Welcome to Topic Tuesday. Topic is digital radiography in pediatric dentistry. So there is a direct digital imaging and indirect digital imaging. In direct digital imaging, there's exposure of light deposited on sensor and directly generated the digital image. In indirect digital imaging, image first captured on a plate and then converted into digital format. Coming to the techniques, first is RVG radiovisiography. There is a 5th generation of RVG. First is Mark 1, which is based on the direct digital imaging, which use the charge coupled device, but they don't have a microprocessor in it. So Mark 2, which is based on indirect digital imaging, they use photostimulated phosphor plate. They have a central processing unit, but it takes time to process. So there is an improved Mark 2 version, which has a better function and stability. Then Mark 3 as a 3rd generation, which use the CMOS sensor, which has a standard version and PC version. Then there is a 4th generation, which is advanced generation, which has an enhanced software and hardware. And the 5th is the latest generation, which include the CBCT. It has a 10 component mechanism of action. When electronic sensor placed in mouth, X-ray directed and capture the image. Now analog converted into the digital image by analog to digital converter, and computer process into the data, organize the pixels and image display on the computer. Then the MRI, magnetic resonance imaging, they use the magnetic field. So human body contain large amount of water, which has a hydrogen atoms and proton in the nucleus of these atoms. When person is in MRI machine, due to the magnetic field, there is a proton alignment in the direction of the field. Then radio frequency pulses is used to disrupt that alignment, and when proton return to their original state, they emit the signals which processed by the computer to detect the image of body's internal structure. Then nuclear imaging, a small amount of radioactive traces injected in the body, they decays and emit the gamma rays, which is detected by the gamma computers and convert into electronic signal which display image on the computer. It is not used in routine but used in certain maxillofacial conditions. Then computed tomography, X-ray tube rotates around the patient, which emits the X-ray, and detector on the other side measure the intensity of the X-ray, which send to the computer and reconstruct the cross-sectional images, which make 3D image of an object. Then spiral CT, it works same as a computed tomography, but a patient table also moves through the scanner as a constant speed, create the helical path. It has a faster scan than computed tomography. Then CBCT, cone beam computed tomography, and as a name suggests, it has a cone shaped X-ray beam which construct the 3D image. Thank you.